Let me ask you a question that may feel uncomfortable. If someone you love were beginning to experience changes in the brain, would you recognize the warning signs before memory loss became obvious? Most families believe they would. They imagine forgetting a child's name, getting lost near home, or being unable to recognize a familiar face. But the earliest changes may be far less dramatic. A careful parent may suddenly trust a suspicious caller. Someone who loves cooking may lose track of a familiar recipe. A normally sociable person may quietly stop returning phone calls. Because they can still remember birthdays and hold a normal conversation, everyone assumes they are simply tired, stressed, or getting older. My name is Dr. James Carter, and today I want to help you notice the changes that are easiest to dismiss. This subject became personal to me long before it became part of my medical work. My grandfather, William, was organized, independent, and extremely careful with money. My grandmother, Eleanor, could prepare an entire Sunday meal without looking at a recipe. When their cognitive health eventually declined, our family looked back and realized that the first warnings had not begun with dramatic memory loss. They had appeared in ordinary moments that seemed harmless at the time. That does not mean every forgotten appointment or misplaced key is a sign of Alzheimer's disease. Everyone becomes distracted. Sleep deprivation, stress, depression, medication, pain, infection, hearing loss, and several medical conditions can affect attention and memory. What matters is the pattern. Is the behavior new for this person? Is it happening repeatedly? Is it becoming more noticeable? Is it interfering with daily life or creating a safety risk? Those questions are far more useful than asking whether someone has become forgetful. Think of the brain as a large transportation network. Memory is only one destination. Other routes help us evaluate danger, recognize smells, follow a sequence, control emotions, navigate familiar places, and coordinate everyday movements. When one route becomes less efficient, a person may still reach most destinations normally. That is why a problem can remain hidden. The person may speak clearly, remember events from decades ago, and appear completely capable while struggling in one specific area. In this video, we will examine 8 changes that deserve attention, beginning with judgment and ending with a behavior families often mistake for lying. We will also discuss a simple morning activity that may reveal a change in coordination. Most importantly, you will learn why symptoms that resemble dementia do not always mean Alzheimer's. Vitamin deficiencies, thyroid disorders, medication effects, sleep problems, and other conditions may produce similar changes, and some of them can be treated. Please do not use this video to diagnose someone you love. Use it to recognize a meaningful pattern and begin a better conversation with a qualified healthcare professional. The first place that pattern may appear is not in memory at all. It may appear in a decision that the person you have known for years would never previously have made. The 8th warning sign is a noticeable change in judgment. For most of his adult life, my grandfather William examined every financial decision carefully. He compared prices, questioned unexpected charges, and never gave personal information to strangers. Then, one afternoon, he received a call from someone claiming that a relative was in urgent trouble. The caller demanded an immediate payment and warned him not to speak to anyone else. 5 years earlier, William would have recognized the pressure immediately. This time, he was ready to send the money. What concerned us was not simply that he had made a mistake. Everyone makes poor decisions occasionally. It was the fact that this decision was completely inconsistent with the cautious person he had always been, yet he felt unusually certain that nothing was wrong. Changes in the brain can sometimes affect the skills involved in evaluating risk, noticing contradictions, controlling impulses, and anticipating consequences. Families may interpret the result as stubbornness, carelessness, or selfishness. But when a normally cautious person begins falling for scams, giving away unusual amounts of money, buying things they do not need, or ignoring obvious safety risks, the behavior deserves closer attention. Look for a pattern, rather than one isolated incident. Ask whether similar decisions have occurred more than once and whether other abilities have changed. If money or safety is involved, respond without humiliation. Quietly review suspicious transactions, reduce access to obvious scams, and arrange a medical evaluation. Protecting someone does not require treating them like a child. The 7th warning sign can be even easier to miss because it may begin with something as ordinary as breakfast. My grandmother Eleanor loved the smell of freshly brewed coffee. She would notice it from another room, and appear in the kitchen before the first cup was poured. Gradually, she stopped reacting to it. She also stopped commenting on bread baking in the oven and the flowers she had cared for every spring. At first, everyone assumed her preferences had changed. The ability to smell can decline with age, but a persistent reduction in smell has also been associated with several neurological conditions. That does not make it proof of Alzheimer's disease. Nasal congestion, respiratory infections, smoking, certain medications, head injuries, Parkinson's disease, and other conditions can produce the same symptom. The important clue is a lasting change from the person's previous ability, especially when it appears alongside changes in thinking, behavior, or daily functioning. You might notice that food seems unusually bland, spoiled food goes undetected, perfume is applied too heavily, or smoke and gas odors are no longer recognized. Because smell contributes to both appetite and safety, a significant change should be discussed with a healthcare professional. Do not secretly test someone with household chemicals or strong substances. Simply pay attention to what occurs naturally and ask whether they have noticed a difference themselves. Judgment and smell may seem unrelated, but both show why cognitive change can hide inside ordinary routines. The next warning is more disorienting. A familiar day or familiar place suddenly stops feeling familiar. The sixth warning sign is recurring confusion about time or place. Everyone occasionally forgets the date, especially after a busy week or a change in routine. The important distinction is what happens next. A healthy brain can usually recover by using context. You remember what happened yesterday, check the calendar, or connect an upcoming event with the correct day. The answer may take a moment, but you can find your way back. A person experiencing cognitive decline may struggle to rebuild that connection. One evening, Eleanor called me and calmly asked what month it was. I answered, expecting her to realize that she had misspoken. Instead, she paused and said the month did not feel right. A few minutes later, she continued the conversation as though nothing unusual had happened. Over the following weeks, similar moments appeared. She prepared for an appointment on the wrong day, and once became uncertain about which bedroom was hers while staying in the house she had occupied for decades. The warning is not simply forgetting the date. It is becoming repeatedly disoriented about the season, the passage of time, a familiar route, or a place that should be immediately recognizable. Some people may leave home for a routine walk and suddenly be unable to determine how to return. Others may wake from a nap and believe it is morning, even when the evening meal is being prepared. Confusion that develops gradually should be evaluated, but sudden disorientation is different. If someone becomes abruptly confused, particularly with weakness, facial drooping, difficulty speaking, severe headache, fever, unusual drowsiness, or a recent fall, seek urgent medical help. Stroke, infection, medication reactions, low blood sugar, and other acute conditions must not be mistaken for normal aging. The fifth warning sign involves losing the sequence of a familiar activity. Eleanor had prepared the same family lunch for years. She did not need written instructions because every step felt automatic. One Sunday, I found her standing in the kitchen with the ingredients arranged in front of her. Nothing had been started. She knew what meal she wanted to make, but she could not decide which action came first. This is different from moving more slowly or forgetting one ingredient. The person may understand the goal, but lose the order required to reach it. You may see this when someone tries to operate a familiar appliance, organize daily medication, pay a routine bill, or follow a route they have driven for years. They might begin normally, stop halfway, repeat one step, or abandon the task because the sequence no longer makes sense. Avoid turning the moment into an examination. Saying, "You have done this 1,000 times, why can't you remember?" adds embarrassment without revealing the cause. Offer calm assistance, note what happened, and watch for repetition. A single difficult day could result from exhaustion, stress, pain, or distraction. A progressive pattern affecting several familiar activities deserves professional assessment. There is another pattern that can be emotionally exhausting for families. The person may remember a childhood event in remarkable detail while losing something you explained only minutes earlier. The fourth warning sign is asking the same question repeatedly without realizing it has already been answered. William once asked me what time our family would arrive for dinner. I told him they were coming at 6. A few minutes later, he asked again. When I repeated the answer, he smiled and thanked me. Before the conversation moved to another subject, he asked the same question a third time, with exactly the same sincerity. At first, repetition can look like poor attention. Sometimes it is. A person who is distracted, anxious, or unable to hear clearly may never receive the information properly. But persistent repetition can also occur when the brain understands an answer in the moment, yet struggles to retain it. Imagine a notebook filled with clear pages from many years ago. The person can still open those pages and describe distant events beautifully. But the pen used to record today's information is no longer working reliably. The answer is heard, but it does not remain available. This is why anger rarely helps. From William's perspective, each question felt new. He was not ignoring me or deliberately testing my patience. Respond with a short, consistent answer. A visible calendar, written note, medication organizer, or daily schedule may reduce anxiety. If repetition becomes frequent or begins affecting appointments, medication, meals, or personal safety, document specific examples and discuss them with a healthcare professional. The third warning sign is a noticeable change in personality, mood, or social behavior. A person who has always been patient may become unusually irritable. Someone who once trusted close relatives may begin accusing them of hiding possessions or stealing money. A previously outgoing parent may stop calling friends, refuse invitations, or sit silently during family gatherings. These changes are often explained away because they do not resemble a memory problem. Families may say the person is becoming difficult with age. But the systems involved in emotional regulation, motivation, judgment, and social behavior are part of the brain as well. This does not mean every episode of sadness, anger, or isolation indicates dementia. Depression, grief, chronic pain, loneliness, hearing loss, poor sleep, medication effects, and anxiety can all change behavior. In fact, some of these conditions can also impair concentration and make memory appear worse. Focus on the difference from the person's established personality. Is the change new and persistent? Is it becoming stronger? Does it appear alongside confusion, poor judgment, repeated questions, or difficulty with daily routines? Approach the person with curiosity rather than accusation. Ask whether they feel worried, depressed, physically uncomfortable, or unable to follow conversations. A hearing assessment, medication review, mental health evaluation, or general medical examination may reveal an explanation that the family had not considered. By this point, you may have noticed that these signs do not exist in isolation. Judgment, orientation, memory, and behavior can overlap. The next changes may be visible in an even smaller place. The moment someone's hands hesitate over an action they have performed almost every morning of their adult life. The second warning sign is increasing difficulty with small, familiar movements. For nearly a year, William struggled with the buttons on one particular shirt. He would look down at his hands, try several times, and eventually leave the lower buttons undone. He blamed the shirt. Our family assumed that stiffness in his fingers was responsible. That was a reasonable possibility. Arthritis, tremors, impaired vision, nerve damage, Parkinson's disease, previous strokes, and several other conditions can make precise hand movements more difficult. Trouble fastening a button is not, by itself, evidence of Alzheimer's disease. What deserves attention is an unexplained progressive change in the ability to complete familiar actions, particularly when the hands remain physically capable and other cognitive symptoms are appearing. You might notice hesitation while using a key, tying shoelaces, operating a remote control, writing with a pen, or handling familiar kitchen tools. The person may need to watch every movement closely, perform the steps in the wrong order, or become frustrated by an action that once required no conscious effort. Instead of secretly testing someone, observe what happens naturally. Ask whether there is pain, numbness, weakness, shaking, or difficulty seeing. Those details can help a healthcare professional determine whether the problem comes from the joints, nerves, vision, muscles, or the brain. The first warning sign is repeatedly placing objects in unusual locations and being unable to retrace the steps. Anyone can leave a phone in another room or forget where they placed their glasses. Usually, after thinking about the previous few minutes, they can reconstruct what happened. A more concerning pattern is finding important items in places that have no connection to their purpose: car keys inside a shoe, medication behind cleaning products, or a wallet in the refrigerator. One day, Eleanor's daily medicine disappeared. We eventually found it beneath a bathroom cabinet, hidden behind several bottles. When I asked how it got there, she calmly explained that she always stored it in that location so she would remember it. She had never done that before. Sometimes the brain tries to make sense of missing information by creating an explanation that feels completely true. This is known as confabulation. It is not necessarily deliberate dishonesty. The person may have no awareness that the explanation is inaccurate. Understanding this can change how families respond. Correcting every harmless detail may lead to fear, humiliation, or an argument that neither person can resolve. Concentrate first on safety. Secure medication, financial documents, car keys, chemicals, and anything else that could cause harm. When accuracy matters, respond gently and redirect the conversation rather than trying to force an admission. These 8 changes are reasons to pay attention, not tools for diagnosing Alzheimer's at home. They can arise from several different neurological, psychological, sensory, or medical conditions, and that distinction leads us to one of the most important parts of this conversation. Sometimes a family prepares itself for an irreversible diagnosis only to discover that the symptoms have another cause, one that may be treatable. Before assuming that cognitive changes are caused by Alzheimer's disease, a thorough medical evaluation is essential. A patient I will call Margaret Collins arrived at the clinic with her daughter. Margaret had become unsteady when walking, misplaced appointments, stopped finishing sentences, and sometimes seemed uncertain about her daily routine. Her family had already begun discussing whether she would soon need full-time care. But Margaret had not yet received a complete evaluation. Her examination and laboratory results revealed a significant vitamin B12 deficiency, along with another medical issue affecting her energy and concentration. After appropriate treatment, several of her symptoms improved. Her experience does not mean that every case of cognitive decline can be reversed, and vitamin B12 does not cure Alzheimer's. It demonstrates why families should not skip the process of looking for other explanations. Vitamin B12 supports healthy blood cells and normal nervous system function. When the body lacks it, a person may experience fatigue, numbness, balance problems, weakness, mood changes, confusion, or difficulty concentrating. The risk can be higher in older adults who absorb nutrients less efficiently, people following a vegan diet without adequate supplementation, and those with certain gastrointestinal conditions. Long-term use of medications, such as metformin or some acid-reducing medicines, may also affect B12 levels in some individuals. This is not a reason to stop prescribed medication. It is a reason to ask a clinician whether testing is appropriate. B12 deficiency is only one possibility. Thyroid disorders, folate deficiency, depression, untreated sleep apnea, dehydration, infection, hearing loss, and poorly controlled blood sugar can all influence cognitive function. Some prescription and over-the-counter medicines may contribute as well, especially when several medications are taken together. A proper assessment usually begins with a detailed history. When did the changes start? Did they appear gradually or suddenly? Which daily activities have become more difficult? Has sleep, appetite, hearing, mood, balance, or medication use changed? A clinician may then perform a physical and neurological examination, review all medicines and supplements, assess memory and thinking, and order laboratory tests based on the person's symptoms and medical history. Brain imaging may be appropriate in certain cases, but no single blood test or scan can answer every question. Bring specific examples to the appointment. She asked the same question 5 times within 20 minutes is more useful than saying her memory is getting bad. If possible, write down when each event happened and whether it affected medication, finances, driving, cooking, or personal safety. Most importantly, do not begin high-dose supplements without professional guidance. Excessive supplementation can create new problems, interact with treatment, or delay the search for the actual cause. Once reversible and urgent causes have been considered, the conversation can turn toward long-term brain health. There is no single food, puzzle, or supplement that guarantees protection, but several daily habits can support both the brain and the body, and those are where we will finish. The first step in supporting long-term brain health is protecting the systems that supply the brain with oxygen, energy, and time to recover. Begin with sleep. Poor sleep does not automatically cause Alzheimer's, but persistent sleep disruption can affect attention, mood, memory, blood pressure, and metabolic health. Try to keep a consistent schedule and speak with a healthcare professional if someone snores heavily, stops breathing during sleep, wakes with headaches, or remains exhausted throughout the day. Untreated sleep apnea can seriously affect both cardiovascular and cognitive health. Next, take care of the blood vessels that serve the brain. Monitor blood pressure, cholesterol, and blood sugar. Avoid smoking, stay physically active within your abilities, and choose meals built mainly around vegetables, fruit, whole grains, beans, healthy fats, and appropriate sources of protein. Alzheimer's is sometimes described online as type 3 diabetes, but this is not an official medical diagnosis. The more accurate message is that vascular and metabolic health can influence the risk of cognitive decline. The second step is giving the brain meaningful reasons to remain active. Repeating the same puzzle may be enjoyable, but novelty creates a different challenge. Learn a few phrases in another language, try a new recipe, practice an instrument, take a different walking route, or learn a skill with other people. Social connection matters too. A conversation requires the brain to listen, interpret emotion, retrieve information, and respond in real time. No activity guarantees that dementia will be prevented. The goal is to combine mental stimulation with movement, sleep, social contact, and good medical care, rather than searching for one miraculous exercise or supplement. The third step is to respond early when a pattern appears. Write down specific examples, including when they happened and whether they affected driving, cooking, medication, finances, or personal safety. Bring that information, along with a complete list of medicines and supplements, to a qualified healthcare professional. If confusion develops suddenly or appears with weakness, difficulty speaking, fever, severe headache, a fall, or loss of consciousness, seek urgent medical care. Above all, do not let observation turn into constant correction. A person who is struggling cognitively needs safety and evaluation, but they also need dignity. Near the end of William's illness, he could no longer reliably connect my face with my name. I still visited him, sat beside him, and talked about the garden, the weather, and the strong coffee he had once made every morning. During one visit, he turned toward me and smiled. It was not the polite smile he gave strangers. It was warm and familiar, the same expression I remembered from childhood. He could not say who I was, but something about my voice or presence still reached him. Memory is not the only way human beings recognize love. Even when names and facts become difficult to retrieve, a familiar tone, gentle touch, favorite song, or feeling of safety may still carry meaning. That is why early recognition matters. It can create time to investigate treatable conditions, discuss care preferences, improve safety, protect independence, and share more clear, present moments together. The purpose is not to frighten families. It is to help them act before a crisis makes the decisions for them. If this video helped you recognize a pattern, share it with someone who cares for an older parent or partner. And subscribe, because in the next video I will explain which health checks adults over 60 may want to discuss with their doctor. This content is for general education and does not replace personal medical advice, examination, diagnosis, or treatment. Never change medication or begin supplements without consulting a qualified healthcare professional. Take care of the people you love and protect the brain that carries the story of who they are.